Good morning. Good morning. I think yes, I made it. It is still morning, even on the East Coast. By a few minutes, but still. Welcome. A hearty good morning. This is Angela McGowan, your professional healthcare advocate, a caregiver strategist, author, and publisher of my new book, and that is called How to Get Out of the Hospital Alive. And you can order it at bit.ly/ to get out alive 1220. So I'm excited. Welcome everyone. If you'd like to join me live on StreamYard, this is the actual guest code that you put in. Hopefully you've already downloaded StreamYard.com. You put that code in, and this is the referral if you too would like to use StreamYard as a platform, and that is bit.ly stream for you. Stream for you. So today I'm going to be talking about my book. I want to share it with you. And this is the Powerful Patient Movement Facebook group. And this is why you need to belong to this awesome Facebook group, because of what I'm going to be sharing in my book today. So let me and my book is actually, the full title is, that is not it. The full title is What You Don't Know Could Kill You, How to Get Out of the Hospital Alive. That's actually the full title. And I want to read some to you from chapter 1. And it is called, not introduction, it is called Your Primary Care Physician, Friend or Foe. I'm certain as you read this chapter that the opportunity will present itself for you to begin to judge your emotions, beliefs, and any feelings of anxiety regarding your primary care physician. Many people believe the doctor is someone you go to see when you can't figure out what is medically wrong with you on your own. Very often, a visit to the doctor is usually the last resort, because generally a patient's belief is that whatever is discovered about their health, it is going to be bad news or sad news. Unfortunately, there is another reason that patients may feel just as bad without ever receiving a diagnosis of any chronic or catastrophic illness. How is that possible, you might ask? This feeling of dejection usually occurs during the appointment with their primary care physician. Around the time when the patient brings up continuing symptoms or other unresolved medical issues that are still very important to them. As they are trying to communicate what they are enduring, they may have received a look from the physician, or perhaps just ignored when they interrupt, which is a sign of displeasure and denoting that they are whining and crying over a small ailment that could be actually taken care of with an over-the-counter medication. It could be corrected. However, when you truly understand that for millions of people, the doctor is the expert, and it is his or her opinion, as well as knowledge and direction, that's revered and desired by the patient to be received. It is no wonder that so many Americans are practicing medicine without a license on themselves and their loved ones, and that both of these groups of patients simply dread going to see their primary care physician. What is the reasoning for this? Well, one reason has a lot to do with being made to feel like a hypochondriac, as subtle messages are given by the doctor that there are patients still out in the waiting room with real illnesses. Secondly, if the patient is unwilling to follow along 100% with the doctor's recommendations regarding medications, tests, diagnosis without any intervention or interruption, they are considered to be a difficult patient. So that's just a little bit from chapter 1. And I wanted to talk to you about what a patient advocate is and why you need a patient advocate. Well, I am a patient advocate, and it is my job to be your ally, your resource, to be your confidant, to be that liaison between you and your providers, the physicians, the labs, everywhere that you need assistance with. Now, we all know that we don't want to go to the doctor. Just go to the doctor like, oh, my head hurt or my stomach hurt, and it lasted 20 minutes and then I got better. We don't want to do that. We don't want to waste our time. We definitely don't want to waste the doctor's time. But consider this, and I'm always saying this, and I hope someone will believe me. Actually, this is prepaid medical. So you've already paid your monthly fee for the ability, the right to go to the doctor. That's number one. Number two, when you get there, there's a copay. Now, there are some insurances where there's not, but usually, even before then, there's paying for parking, then there's a copay. So you paid your monthly fee, copay, there's parking. So let's just say you've paid 3 times already and you haven't even seen the doctor. So now you're in the office, you're waiting, you wait your turn, you've gotten there at a reasonable time before your appointment, you get there and immediately you're in the room being made to feel like, can you just hurry it along? Like, what is the point? Like, what are you saying? Even if you have something acutely wrong with you that has been a continuous situation, you sort of back up and feel like, well, what I really want to ask you about is, and you may ask that question and you may get the answer. And with that, the doctor stands, goes toward the door, and you're more or less dismissed if you don't say something else. Of course, this is not a live about being against the doctor. It is about being for the patient, which is what an advocate is. So be it a hired advocate like myself, or that you bring a family member, someone with you. When you're in the doctor's office, when you are anywhere with another person, you get a different type of treatment from that very same doctor. Because now it's not just being dismissed. Now someone else is actually there witnessing what is going on or what is not going on. The fact that you're asking a question and more or less like, all my patients are going through that. That's nothing really to be concerned about. It was a concern enough for you to arrange your schedule, perhaps take off from work, perhaps get a sitter, perhaps whatever arrangements you made, you're already paying for this service. My advice, as I wrote this book, is for you to understand that you are not being a difficult patient. There is not, you are being a patient, period. Because you realize that you are going to the doctor's office who is the expert. The problem is you are going to the doctor's office as the doctor's patient. You are not going to the doctor's office as a powerful patient. A powerful patient is always positive. You expect the doctor to be there and that the doctor has the advice you need. And then a powerful patient is passionate about their health, because the healthcare journey is one you want to do with excellence as best you can. And you're not neglecting that journey because you have come to the doctor. But let's face it, if you're getting those kind of vibes like you're back again or whatever the greeting may be, you're going to go to WebMD, Google, you'll be looking up things, and misdiagnosis will be coming from you. So I'm asking you to, let's get together and join in the powerful patient movement so that you extract information and get the big three: the diagnosis, the plan of care, and treatment options. That's why you're at the doctor. You're not going to the doctor just because you're looking for company or you think they may have some snacks in the lobby. Certainly not. But you should be respected. You should be treated well by the staff. And let me make sure you understand this. This is your medical team. You chose them. You went to the insurance portal and you chose this physician. And now you're working with his staff and his, whether that be clinical or administrative staff, and also the extension staff of this physician is the one that you find at the hospital as inpatient. So be clear on the fact that you don't want to go to the doctor's office who does not want to be on your team, Team Jones, McGowan, Williams, John, whatever your name is. If they don't want to be a part of your team, then it's your responsibility and it is your right to get a winning team, to get another physician. All of these things we're talking about and we're going to instruct you on in the Powerful Patient Movement. Why don't you go today? It's a free membership, bit.ly/Powerful Patient Movement. All one word. And don't forget that it is available for you to get my book, How to Get Out of the Hospital Alive. And I want you to make sure that it is part of your daily reading because it is just that important. Something is always going on for healthcare. We want to make sure you know what to expect. So I'm asking you to make that a part of what you do today. Pick up that book. And not only that, I want to also remind you that on Sunday at 5:30 Pacific Standard Time, join me here for Say It Sunday. Our theme this year is New View and the Self-Care You, and we're going to be talking about more self-care for the caregivers. This is Angela McGowan, your professional healthcare advocate, caregiver strategist, author, and publisher of the book, How to Get Out of the Hospital Alive. And you can get that at bit.ly/to get out alive 1220. Remember, you are a powerful patient. And if you feel that you're not, the Powerful Patient Movement is for you. We can show you how we must all stay powerful 24/7. That's right. Have a blessed day. Blessings and joy. That's my wish for you on this Friday. Have a great one. Talk to you soon. Bye.